kinds of, a lot of our efforts in the past, which have, been pretty successful. I don't know if anyone has anything to add to that.
Dr. Savaro, please.
Yeah, I was just going to add to sort of lead on from what Richard was saying about the efficacy. So the vaccines that were developed for pandemic influenza purposes are evaluated in clinical trials for safety and immunogenicity. So their ability to induce the type of immune response that we anticipate will be protective. It has not been possible to assess the efficacy of or effectiveness of any of those vaccines because we simply don't have enough circulation of those viruses, and that's a good thing, to know whether they would be effective or efficacious. So the assessment that we have to date is on safety and immunogenicity, and that gives us the confidence, based on everything we know about other influenza virus vaccines, that they would be anticipated to be effective. Thanks.
Thank you both. One more question from Helen Collis, but I don't have an outlet here. So Helen, please identify yourself.
Thank you very much. My name's Helen Collis. I'm calling from Politico. Could you please tell me your thoughts on the potential for the new messenger RNA technology in developing vaccines quickly, if needed, against this concerning strain, and how that technology may have played into the pandemic preparedness plans, if at all? Thank you.
Yeah, I guess we start with Dr. Webby again, or no? Dr. Wentworth, please go ahead.
Yeah, I'll try to tackle this one. So I think, you're all well aware of the power of mRNA technology to rapidly produce vaccine, and that was demonstrated by really good vaccines made against SARS coronavirus 2 or COVID-19. There's a lot of investigation by those same companies now and by others into how to adapt that technology for influenza and for any other pathogens of concern, but particularly those that could potentially be pandemic, in part because of the speed with which it can be produced and potentially the global dissemination of that vaccine, other countries being able to produce that on their own as well. So I think there's just a lot of effort in that space right now. There's not a lot of there's hope that it could reduce timelines, and that can be particularly important for pandemic purposes. But I think, as Dr. Briand said, part of the influenza situation, which is quite specific to influenza, is because we have active vaccine production always happening, and the scale-up capacity of the current vaccine manufacturers is quite great, that if the decision to switch is made, it can also be made rather rapidly. It was about 100 days for the 2009 pandemic to have a vaccine. And so I think there's a variety of regulatory components that would have to be achieved for new technologies like mRNA or any other, like if it was DNA or other approaches. But I think everyone's very hopeful that this will be a technology that can be applied to flu and will be able to determine its benefits or not.
Thank you. Anybody else to add? No. Then we'll come to Jennifer Rigby from Reuters. Jennifer, please go ahead and unmute.
Hello, thanks for taking my question. I just wanted to ask, seeing as we have had a handful of human cases with H5N1 in the last for this clade, recent months, and then for H5N1 and other clades, over the last however many years, can you tell me why the Cambodia cases are raising such concern or getting such attention? Like, what's new? What's the new concern right now?
A very good question. You want to start with Dr. Briand?
Yeah, so it's a very good question indeed, because it's part of the vigilance we are having around human cases in general. So far we have seen a lot of sporadic cases, meaning one case here and there. And so when you have only one case, you imagine that it's because this case was exposed to animals, either live or dead, and also that or to the environment. So for us, it means that it's a zoonotic transmission from animal to human. But when you see that there are a number of potential cases surrounding this initial case, you always wonder what has happened. Is it because maybe the initial case has transmitted the disease to other humans? And so we are really concerned about the potential human-to-human transmission coming from this initial spillover from animals. And so this is currently the investigation that are ongoing in the contacts of this girl in Cambodia. We are first trying to see if those contacts have H5N1 infection, and that's why we are waiting for the laboratory confirmation of those cases. And secondly, once we have this confirmation, we will try to understand if those people have been exposed to animals or to potential exposure to contaminated environment, or if those people have been contaminated by the initial case. And so this is a difficult investigation, requires really people going to the field and really assess the situation. And so that's why we are currently waiting for those results. So as we said, we think that currently the risk assessment is not changed, but we are really looking at this new information to see if we need to change the way we see things or not. Thank you.
And Dr. Zhang.
So you asked about the numbers of the cases. Since September last year, we had 6 H5N1 human infections. And as earlier on, Dr. Webby said, actually in total, we have more than 900 H5N1 human cases. So if we look at the number, well, it is really sporadic infections currently occurring. With regards to why we are so interested or pay so attention to that case, I just want to add to what Sylvie just said is really about the associated risk of pandemic. And so not only for this case, but for each and every human infection, we've been looking very closely to conduct thorough investigation to understand whether further transmission is going on and conduct a risk assessment.
Thank you both very much. Now, last but not least, since we opened with Helen Bransford from start, we can have her close. So Helen, last question goes to you.
Thank you very much. Dr. Wentworth mentioned a couple of minutes ago that the capacity to scale up flu vaccine production is quite great with the existing manufacturers. Has anyone done an assessment of how much vaccine, H5N1 vaccine, could be produced sort of over the course of a year, for instance, with existing production? I know that, human testing of those vaccines showed that the antigen need was quite high per person. Do you have a sense of, and people would probably need 2 doses or potentially, do you have a sense of what production would be like? Thank you.
Let's see if we have more than a crystal ball here. Let's start, Dr. Wentworth.
So that's a good question, Helen, and I'm not the right person to address it. So I just wanted to make sure I commented that back to you, that I don't have a good idea of what the production timelines for a particular H5 would be. I would tell you in some ways it's quite similar to seasonal influenza virus. It would depend a bit on how well the yield of that particular antigen is. So with every different specific strain of influenza, you can have a different yield. And you are correct. I think the anticipation is that it may need to have a prime and a boost because people really haven't been exposed to H5 for one reason, and in part because of the H5 immunogenicity. So you're correct about that. That is also why Dr. Webby mentioned the adjuvants, which would be dose sparing, so that you could potentially adjuvant the vaccine and not require as much to boost it up. But to get to the specifics of how long it would take, there are going to be variables that would have to be considered. And then other parts of, for example, if it was, I think in specific countries, it would be different. And so I think they would have to address that specifically.
Yeah, and also depends on the type of platforms that are used for vaccine production. And currently, most of the influenza vaccines are largely egg-based production. So it depends also on the availability of eggs, of course. But from 2019 estimates, we thought that, and again, depending if we use adjuvant or not, and so lots of variables, but we could have 10% of the global production could be in a range of 400 to 800 million doses of vaccine for the first year.
Thank you very much. And with this, we've come to the end of our really long briefing. And I want to thank really all of you online here for a fantastic, great discussion we had today. And of course, here to my panel, Dr. Bonafante, Dr. Webby, Dr. Wentworth, Dr. Subarao, Dr. Zhang, and Dr. Briand, and all those watching us online on social media. Thanks for this.